Hello, hello. Welcome to another episode of the Unreal Results podcast. Have another little bonus episode for you. Speaking with another LTAP Level 1 alumni. This time talking to my friend and colleague, Bethany Clark. Bethany is a massage therapist up in Boise, Idaho, and has been in the community for quite a long time. Has taken both the online course and the in-person course. So she joins us today talking about how she integrates this into her massage therapy practice, specifically also working a lot with people that have post-traumatic stress and just working in a way that really supports the autonomic nervous system. So looking forward to sharing this conversation. Hope you enjoy it. Hello, my friend.
Hello.
Welcome to the Facebook Live, the Missing Link group. And then also to the Unreal Results podcast, because I'll put this on the podcast as well. I'm really happy that you were able to do this, and thank you for being here. And I told you on the backside kind of like what we're talking about, but in general, this is more of like a informal conversation just to sort of share about your journey with the LTAP, how, what led you to it in the first place, whatever unwanted experiences or problems that you felt like you have, and how has it changed your practice, and, both from results for your patients, but then also like what we were just talking about with Katrina was like personal, professional, like whether it's like, going from burnout to feeling better, or like raising your prices, or like seeing less patients, or like whatever it may be, right? All those things that like are the effects of getting better results for our patients. So, yeah, anyways, everyone, this is Bethany. She's a massage therapist in Idaho.
Boise.
Yeah, Boise, Idaho. And she's been in my community for quite a long time and has done both the online and in-person LTAPs. So, welcome. I'll give the floor to you. You can share what kind of like clients you work with and stuff too. But
Okay. Yeah. As you were like saying those questions, I was like, I hope she remembers those questions because I was like, I don't know if I'm going to touch on all of it, but I want to.
I'm glad. I will ask you the questions if you don't answer. I will reframe it.
Okay. I actually love that you sent that email and you're like, hey, short notice. Sorry. Can you do this thing? And I was like, I actually love that because I literally had maybe 10 minutes to like do that. Yeah. And it forced me to be really succinct. You knew what you were doing, Kay. It forced me to be really succinct and to just like get something out there.
Yeah.
And that's like what happens with clients too, is you don't always have the luxury of like, they ask you questions and you're like, this is what I'm doing. So I really actually like that.
Yeah. Sometimes when we have less time, we're just
do it.
Yeah, just do it. So it was not on purpose. That was because I have had a million things. And I was like, oh shit, I need to ask people for video testimonials and things. But yes, I'm glad it was helpful that way.
It worked out perfect. You can just be like, yeah, it's totally.
I did that on purpose.
Yeah, that's how it was supposed to work. Man, Anna, I first heard you on Shantae's podcast a million years ago. It was probably like 2018.
Mm-hmm. Yep, that is exactly what it was.
And I honestly did not understand most of what you were saying. I was like, I don't even know what an athletic trainer is. And you were talking about your transition from Exos to something else. I was like, I don't even know what Exos is. Like, I have this world, it's like such a big, important place. And I like just didn't know.
Is it? But I don't know if it is, but
okay. Well, when you were there, maybe it was.
Yes, maybe when I was there, it was a big deal.
Yeah.
I'm just kidding.
I had just graduated from massage school. I was a dental assistant for a long time, and this does matter in the scheme of what I'm going to say. But I was a dental assistant from the time I was 16 until I was 36. And then I decided to do a career change to massage therapy. And I read Body Keeps the Score, as one does in their mid-30s. And I was like, there was a chapter in there that talked about working with post-traumatic stress in massage therapy. And I was like, I don't know, it like literally something clicked in my brain. And I was in like a Whole Foods parking lot and I called a massage school, and I was like, "Do you guys like, how do I apply? How do I get a
How
like?"
does this work?
Yeah, I was like,
Yeah.
"This is just something I have to do." So I did like a tour, and then I told my husband, I was like, "I think I should do this. They're enrolling next month." He's like, "What are you talking about?" Like, I don't know, 15 years from retirement, had worked in a great office.
Yeah.
Um, but yeah, it was very important to me to like work with people in that way, especially in the dental field. We You can see that people are dealing with stuff, but it's not within your scope to address it at all.
Yeah.
The last office I was in, we did migraine care, and people will tell you stories, and we fortunately could work with pain in that way. Um, but I don't know, something about like learning. I was at the front, like billing insurance, but like I learned the training of how to work with migraines, and some of it was manual therapy of like the jaw and the neck.
Mm-hmm.
And just being in that position with people, I was like, okay, I should not be behind a computer. I should be like with people.
Yeah.
So I went to school for massage therapy to work specifically with post-traumatic stress. And then I went to school and talked to my teachers about it and like did research, whatever. And there's like no formal training to do that. I read it in the book. So I was like, this is a thing that people do,
Yeah.
but like it's not a thing people do. Or massage therapists just figure it out, or they're like naturally intuitive.
Yeah.
So, I was a very disillusioned, but I also needed to get experience just doing massage. So, um, I started listening to Shantae's podcast because I knew eventually I wanted to do something online.
Mhm.
Um, yeah. So then I came across your stuff and I was like, I do not understand any of the words that she is saying. I don't know what this means, but there was something to it that like, there
My
was something
athletes laugh at me because they're like, "You always try to make it like normal people talk, but I still don't know what you're saying." And I was like, Which
And I mean, granted, I was just out of school, so I had very little vocabulary for it. But yeah, so I think I just started following you, and everybody who had worked with you was like, you have to work with Anna. Like that's just like when people are in your ecosystem, it's
Yeah.
like you just have to be in there.
Yeah.
So I think you offered it was like something similar, like missing link, something where you learn like the
Oh
first
yeah, the result cheat code.
results cheat code. Yeah.
Mhm.
So I got in on that, and one thing that was so weird for me is like coming from the dental field, everything is a test and retest. You take an x-ray, you
Oh,
want
right.
pain, mobility of the tooth, like whatever. There's always a baseline and then there's a return. Like, did this improve? Did our surgery work? It was mind-blowing to me that massage therapy, you're like, hey, how do you feel? Okay, take your clothes off. Okay, and then you go and you're like, do you feel better? Okay, bye. I was like,
Yeah. How medical care is.
this cannot be like how an entire industry functions, and it is.
Yeah.
So I felt like if I'm going to work with people, I started looking for like orthopedic tests or some type of testing
Mhm.
because I wanted some type of baseline. I didn't know what baseline I should be like. Is it
Yeah.
mobility? Like, I don't know. I started looking around and I found like very specific, like physical therapist type of thing where they're like 5 degrees of flexion. And I was
Oh,
like,
right, right.
I can't, that's not within my scope to
No.
like measure.
And not helpful.
Okay, and then once I
Yeah.
learned from you, I was like, "Okay, I saved money because it's."
Yeah, I'm like, does that really tell you anything? Not really.
Yeah. So I, especially wanting to work with post-traumatic stress, I'd already started, like, seeing clients that were kind of along those lines,
Mhm.
and, a lot of the language around it is very vague, and it's, like, actually not technically accurate, so they'd be like, "If your clients are in fight or flight," I'm like, "Those are 2 different things. Fight, flight is not the same thing." But
Yeah.
people would be like, "Oh, they're in this state," and I'm like, "I'm not in a position to I didn't learn how to, like, diagnose that or, like, because they seem stressed out to me, that's not, like, an actual thing." So all of it was frustrating. So when I was learning from the results cheat code and it was like, okay, pain, people are coming to see me with pain in the body. And if they have something going on with the nervous system, it's going to affect how well my treatment will affect them.
Yeah. Mhm.
And so when you were talking about the viscera versus the nervous system, I was like, oh my gosh, there is a way to like physically assess if the nervous system is truly holding something back physically. because some people will come in and they do seem agitated, but they don't test for a nervous system limitation. So that was like, it literally, like, I felt like I was looking for a long time for like a foundation to my work that wasn't just like Swedish massage. And I feel like that those first like few tests of the LTAP were like, that is the foundation that I can stand firmly on top of and say, I'm not trying to guess. I'm not deciding if you are in some type of nervous system state that I'm not in a position to judge.
Right.
I'm still working with the body. I'm working with how your nervous system's managing the rest of like your pain and tension. I'm doing it totally within my scope of practice. And it's in a way that I can communicate clearly to my people. So they're not like, it's not this mysterious, like, oh, Bethany's doing, like, no, you can like feel it. Like,
Yeah. Yeah, you can feel it.
Yeah.
Yeah, and it's so good because, like, you know, a lot of this time that comes up when I'm teaching is, and this I think goes back to just like a greater overarching realization. And I don't even know why, like, to me, I get it, but people need to go through this realization that even though we talk about the nervous system a lot of times now, and it's getting so trendy now, but people still don't really understand the nervous system. And also, it is confusing because there's a difference between like the neurophysiology of things, like the autonomic nervous system,
right.
and then the actual nerves in the brain and the spinal cord. And though, yes, everything sort of works together, they are not one and the same. And so we can have central nervous system tension, but not be out of balance autonomic nervous system physiology, right? Or vice versa. We can have both, or opposite. We can be very out of balance, low vagal tone autonomic nervous system, but not have any central nervous system tension, right? And so, but then also understanding when there's a protective pattern around the viscera, that affects the autonomic nervous system. Right?
Yes.
And it also affects the central nervous system.
Yes.
And like, spoiler alert, it affects the peripheral nervous system.
Right.
So even like having a way to organize all of that, but then speak to it, I think is so interesting. Kind of like, you know, with a lot of the post-traumatic stress type stuff that you see, it's like, I think sometimes people get labeled as post-traumatic stress when it is not necessarily that. It's just a, you know, imbalance of their autonomic nervous system, which
I
does,
can't,
you
we
know,
could just
like,
mic drop it there. Like, just that's the end of it.
yeah, when it's not. Yes, exactly. But because we're still sort of like trying to understand the autonomic nervous system, and even the idea of like, you know, there's this kind of overarching thought that the sympathetic nervous system is bad, and I'm like, no, the sympathetic nervous system is great. It keeps us alive, and then also like we want it to function so we can, like, you know, do things.
Yes.
Like,
get up out of bed.
Yeah, like our visceral organs like run from that input as well as the parasympathetic input. Like, they really are teammates.
Yes.
They're such good teammates. And so that's just like fascinating to me. And it boils down to, because it's such a complex organism, we're just trying to reduce it into parts to make sense of it. Like, we want it to be like a math equation. If like A plus B equals C, then great, you know?
Yeah.
And it's just not like that.
Yeah. And it's like adding in that a lot of this like bottom up, top down processing happens in or near the limbic system, is like, now we have a whole other component of what the person on the table in front of you thinks that all of this means.
Yes.
So like, yes, there is like this range of motion limitation. I'm testing, the nervous system's telling me that there's something going on here, but what they think that means about them is like, now we have a third thing in the room that needs to be addressed, because the meaning making is, you know, not separate from like the anatomy model that we look at. There's now a person who perceives that this is occurring.
Yes.
So yeah.
And so interesting you bring that up, because it's like, not only is it like how they're perceiving what's happening in their body, but are they perceiving it, or is it a story that they're believing that they were given from another healthcare provider? And that's what is like, if all I can teach people is about the wisdom of their body is to stop telling fucking people stories about their body. It's like, that would fix so much. That would fix so much. And like, how many times did people come and are like, well, my doctor said never to bend down, like never to flex my back because my discs are going to explode. And I'm like, first of all, they probably didn't say it that way, but also
Right.
that's what you heard. That's what you heard. And so that's what you now believe. So it's like, yes, this concept of this belief system, like how our beliefs shape our thoughts and affect our actual nervous system, our central nervous system.
Yeah.
Then also our autonomic nervous system is like so complex.
There's so many things.
So many things.
Just to speak to that for a second, I listened. Missy has a new podcast out today.
Yeah.
And one of the person on her podcast, a practitioner, said that her client had broken her arm in 3 spots, and one of the spots it broke was near the head of the humerus.
Mm-hmm.
And the doctor was saying, if we don't get, there's a chance that you might not get good blood supply to the head of the humerus, and it could result in like blah, 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 whatever. So the lady comes in to see this practitioner and she's like, I'm at risk for a stroke. And she's like, what do you mean? So she asked her, can you explain this to me? And she's like, yeah, he said that I might not get blood supply to my head, because she didn't know that the head of the humerus is a different part of her anatomy. So she's literally walking around like, I'm at risk in a stroke.
Have an aneurysm. Yep. Oh my gosh.
So
but
yeah,
it's like so true.
Yeah.
Yeah. Sometimes what people say, and this is like, I try not to get like pissed at the doctor.
I know. Yeah.
From a game of telephone of what the patient said that the doctor said, because chances are the doctor might have not even said that in the first place, but that's what they heard.
Yeah.
And so it's like, okay, if that's what they heard, then we
that's what we're working with.
But, and my biggest thing is like, if I can be one less person to tell them a story about their body, then that's a good thing. And then it's my job to unravel all those other deeply held beliefs about their body.
Yeah. One of the things that I don't even think it was part of the LTAP. It was just, maybe I took all your, regen sessions. I think that's where I learned it, but you taught like, a liver, just like a liver manipulation. So you like test your arm movement or whatever, and then you like pull the 4 directions with the skin by
the skin lift. Yeah.
Yeah.
Honestly, that might have just been on Instagram.
Okay. Like maybe that was it.
Yeah.
But even that, like I've done that with people, and just that, like the stories and like perception people have, especially like menopausal women often will get like shoulder issues, frozen shoulder and that type of thing. To do like just something so stinking simple, it's like 2 minutes of their life, and they get like range of motion back.
Just to simply show them the story they're believing is not true.
Yeah. And like your body, and I try to always put it back on them and like the wisdom of their body and what your body's capable of doing. Because if that movement is gone quickly, can you get it back quickly too?
Yeah, absolutely.
Like, you know,
like
this
you're
is
a hope dealer in that sense.
Yeah, maybe.
Yeah. Yeah, you're giving them hope that it's like, it's not as permanent as you think it is.
Yeah.
So cool. I know we kind of got off on a tangent because we talked about what we're excited about, but to like circle back. So it sounds like you came to the LTAP because you were trying to filter out like how the nervous system and the viscera and the musculoskeletal system kind of all work together, and also how to like target it, or like know when to target certain spots in your sessions.
Yeah, I just needed some type of assessment to like anchor the session, so it's not me guessing or like and I feel that a lot of I don't know if I should say a lot, but I've had clients come to me, and within this world of like working with post-traumatic stress, it's like it's kind of the Wild West. And so some people have been to practitioners that it's like some projection of like so drippingly like, oh, you're in pain, and like they want to speak to like the inside of the person. It's like, well, I'm here because of my shoulder. So like, yes, I have a history. Yes, there's stuff going on with post-traumatic stress, like the body doesn't respond in traditional ways. And so these people have often been to multiple providers. Sometimes there's nothing medically wrong with them, but they're having symptoms that should be answerable by the medical community. And so it was really important to me to come to them almost. I am a heart-centered person, but those years of dentistry gave me like, there is a clinical,
I would say clinicalness of it.
Yes. I wanted to come with that so that it's not just me and them. Like, I don't want them to feel like you find one practitioner who like gets you and then you're like anchored to them. I didn't want that kind of relationship with them. I wanted some, I don't know if distance is the right word, but something that felt clean. Like, this isn't just me projecting or me deciding based on my life's experiences. Like, I need hard and fast. Like, what is happening in your body? Can you feel it? Can you own this?
Like concrete evidence and like a little bit more scientific approach about massage than it traditionally is.
Warm and fuzzy. Yeah.
Mm-hmm.
And the warm and fuzzies there, I'm still very intuitive. I still work with them, but just having that as the starting point, I just love it so much.
Yeah.
And I'll tell people, I'm like, this is, I'm just going to do an assessment really quick so we can figure out where to start treatment. They're like, okay.
Great. And actually, that I'm glad you bring that up, because that's a question with a lot of massage therapists when they come to the classes is like, how do I fit this in a traditional massage? My answer always is, you just tell them what you're going to do. And also, if you want to keep tradition in terms of like draping and having the sheets and like letting people unrobe and stuff, like you just do run round, or you do round and you do the best you can. The reassessment. But yeah, speak to sort of the way you use it.
My approach. I alternate depending on my client and kind of how I perceive them to be coming into the room. I'll either do the standing march test or I'll do the laying down. Most people I prefer when they're on the table. And so most people I'll just do that. And that's a way for me too, to like establish trust of like, I'm the practitioner and this is an assessment that I like to do. And of course, I'm very sensitive to like, if people aren't comfortable in that position, it's intimidating to have somebody like over you and like, what is this? But I also want them to know, like, I'm going to respect your boundaries and I'm going to explain to you everything that I'm doing. And so doing the assessment is a way for me to introduce them to my approach. But yeah, I'll either do the standing march test or on the table. Sometimes people aren't coming to me with anything specific bothering them. And so I don't know. You've always given us like such autonomy of how to apply the LTAP. So this is my true statement, Anna, is sometimes I'll do the first test of the assessment. I'll do the first two tests. If I need to, I'll go through the viscera and just kind of as a checklist and like see where I should start. Julie gave me really good advice when I went to the in-person LTAP of just isolating by quadrant. Because sometimes I'm like, what if I find something in the spleen? What am I going to do? Like, we're going to start at your spleen. I'm not trained in visceral manipulation. So thinking of it in quadrants has been really helpful for me. And then I can always go back to nerves, like what part of the body, where are those nerves in the spine? And then I can just work with the spine cupping or something along there to start it. But because I'm not always addressing, like, they're not coming in with like acute knee or shoulder issues. They're just coming in for like a good massage. I'm using it more of like, where do I start to get the most effect? Because if I start my normal massage before the LTAP, it's not uncommon to come across a part of the body that's like there's resistance to getting through the thing you want to get through. And so if I can start on like their left foot, and then so by the time I get to the upper body, it just melts through. Then I don't need to necessarily retest them.
Right.
You know what I mean? So
it's so much better too. Like, cause I know like sometimes when I'm getting a massage from people, it's like, your timing is like going good. And then you run into that spot and you're like, shit.
Yep.
It's going to take forever. And I still have like both arms in there, whatever to get to. And so it's like, when you can start where the body wants, you don't run into those resistance points so much. So yeah, that's cool. I love to hear that. Um, is there anything, I'm trying to think what else I kind of wanted to cover. I mean, I guess really too is like, is there anything, you know, well, one, I don't know if you spoke to like the kind of results you're seeing with your patients in terms of like, I mean, it's a little different for massage, right? Because some people just want to come regularly for a massage, which is
Yeah.
great. Um, so I don't know, from a result standpoint, it might just kind of be exactly what we just said is like when you go where to start, you don't run into those like blocks. But then also, how about results for you in terms of like, have you been able to like raise your prices? Do you just feel more inspired by your work every day? Like, do you have a wait list? Like, has it changed any of that stuff for you?
Um, I don't I mean, these are, like, borderline business questions versus, like,
Yeah.
practitioner questions,
Yeah.
but so I recently moved offices, and it was
Oh,
really
yeah.
important to me to keep my rates the same.
Yeah.
Um, but
Which is
I
fine,
will
and
Yeah,
I'm like, I always tell people, I'm like, "That's not the goal."
yeah,
But sometimes when people start noticing they do better, they're like, "Oh, shit, I can raise my rates." I'm like,
yeah,
"Yeah, isn't that great?" But, yeah,
yes,
people don't have to by any means. For
yeah,
me, I'm just like, I love being awe-inspired by every person I come along. I don't need to, like, get more money for it. It
yeah.
just feels more fulfilling anyways. Yeah.
Yeah, I think for me, it feel like that anchor point, like, for me, coming from such an established field where, like, nobody is asking you, "What is the point of this dental cleaning?" Like, they just get it. Like, it's so established as, like, an industry that you just do things and people there's so much to fall back on, I guess. And when I was walking into this type of massage therapy that I wanted to do, I felt like I was falling down a black hole. I was like, there's nothing for me to rest on. There's not The science is new. People still don't even fully accept the polyvagal theory, which is like what
Yeah.
most of this is based on. Like, there's a lot of slippery slopes here. And I don't and I'm working that's good in concept and theory. And we just have to, the next 30 years, we'll see how that unfolds.
Yeah.
But in the meantime, I'm touching real people with my hands and I need something solid that I can like lean back on.
Yeah.
And so for me, if I can feel that like the nervous system is doing something, I can feel something or know where I need to like start treatment. To me, that was like the solid ground that I needed to
Yeah.
just feel confident in like I can stand on that and then any other training I take, any other skills I have, I know that it's on the back of something I felt with my hands and I can like reasonably understand what is
Yeah.
occurring on the person in front of me.
Yeah. Do
So,
you
yeah.
this is a total side note only because I'm like curious too is because I know you've learned from polyvagal theory like more from just me. Like I
Yeah.
know you've done all your things. Do you utilize Stephen Porges's body perception questionnaire at all as like an intake and like way to track your clients? No.
No.
Might be.
Go ahead.
I'm like, that might just be like another like objective measure that you could do to see, and even for your clients to see um a change in it's basically just symptoms is basically looking at your reactivity of your autonomic nervous system, and it
Mm.
gives it numbers, right? Like, it's like how often do you have belching during the day? Like
Oh,
all the
okay.
time or not at all? And then all the time is 4 points and not at all is 0. And then it gives you a general range of if you're in the, you know, hypersympathetic
Okay.
or the dorsal vagal like burnout. It really gives
Okay.
you a good baseline that's cool to track. So I do that in the mentorship program. I have everybody that goes to the mentorship program, I have them do that at the beginning and at the end because part of the mentorship is like doing the work in your own body to
Right.
heal your own nervous system physiology so you can be more present for your patients. And so it's like, it's really cool to see
Yeah.
numbers associated with some things that seem very subjective sometimes of like,
Yeah.
one person with their mentorship and they're like, oh yeah, like before and after your mentorship, like I didn't have, um, my dairy intolerance went away,
Oh
or
my
like
gosh.
somebody was like, "Oh, used to like stutter a lot, and after your mentorship, like I don't stutter like I did," and like
Wow.
just like things like that that like you're like, "What?"
Yeah.
But if we had but when we look at their autonomic nervous system reactivity, it's like, "Oh yeah, your numbers were like so high, and now they're like so much lower." So
No, that's cool.
if you haven't thought about it, it's something simple to give your clients that you could do. So
Okay. No, I like that. I
yeah,
I feel like there and maybe that's even like a good delineation, I guess, for me um because I do have clients that have gone through like such a medical and psychiatric like
yeah,
gauntlet. There's a
yeah.
part of me that like I do want some concrete assessment tool, but I also don't want them to feel like I'm categorizing them.
Oh,
So
for
I'm
sure.
careful to avoid like certain language and I want my space to feel like um yeah, like it's scientifically based, but I don't want it to feel like any other practitioner they've ever
Yeah,
been to. I never ask about their story. I mention post traumatic stress a lot in my marketing. And like if they ask me questions before they come in, but once they're in my room, I almost never
yeah,
mention it.
yeah.
Um, so so
That's
even when
fair.
you're saying that, I feel like almost an aversion of like, that's a little too clinical for me.
Yeah,
But
which is fair.
I do understand, like,
I
I
don't
think
give
that
it
can
to everyone.
yeah,
I ask them, especially if they're like, "Oh, I just have so much stress." And I think, the high level of stress is like part of what's driving my stuff. I'm like, well, there's a questionnaire that you can fill out that would give us some baseline numbers and we could really see, we could have a better idea of like,
I
is
like
it
that.
is it really a lot of stress in your life or are you handling it just well? And I always tell them, like, it doesn't matter. I was like, the information is for you, not for me.
Yeah.
It's not gonna change what I do with you.
Yeah.
It's more of a like something for
Feedback for
you. Yeah, exactly. Something for you and something to track and like a conversation starter, not a not a not a put you in a box thing.
treatment, yeah.
Mhm.
Okay,
Exactly.
I like that. I'll oh, thank you. I am, like,
Yeah.
open my mind a little bit to doing that
Yeah, yeah, but
'cause I
also
like
it's
that.
like yeah, it's take it or leave it, but that
Yeah.
is like what popped in my brain because I think it's kind of cool to see. Because a lot of I like the questionnaire too because a lot of times people don't even realize some of the symptoms that are on autonomic nervous system reactivity, and so sometimes it's just eye-opening to be like, I had no idea that was a thing, but I experienced that. For me, it was like one of the questions was basically like, when you're eating, do you have a hard time like breathing at the same time?
Mm.
And I'm like, "Oh my gosh."
Okay, that's
Oh my
actually
yeah.
my husband is, like, the loudest eater, breather person on the planet,
Mhm.
and I always make fun of him for it, and now I'm like, "Oh,
Yeah,
I
'cause
should"
it's like when our nervous system is out of balance, your respiratory and your digestive system are getting different, like, inputs, and so
Signal
sometimes we
yeah.
can't coordinate those things.
Oh my gosh.
So
Well, now I feel like a bad person, but it's fine.
no, it's alright. You can still make fun of him for it. Anyways, here we are off topic again. Um But I know I've been on the live now for an hour for people, so I'll kind of like bring it home, land the plane, wrap it up. But if there's anything, so what I would have asked people is like basically like if somebody's on the fence about taking the online or the in person or both course, what would you like what would you say to them? And also like not just like Anna's great and the course is great and like don't, sign up, more of like, you know,
Things.
more things, like, less like, "Yeah, of course, thank you, I appreciate all that," but also, like, give them something new of why, if they're on the fence, why it's, like, the course for them.
Okay, let me think about this. One thing I would say is because I am coming from such a different side, my perception is like physical therapy, athletic trainers, like you guys are so incredibly trained with anatomy and like I'm on the other edge of the spectrum where I feel like massage therapists are given literally like the base
Mhm.
level needed to like not harm someone. Like we have so it's up to us to like continue our education. So I'm saying that because if somebody feels like the LTAP is out of reach or it feels like too big or like too much, like I feel like I came in at the most basic level of education to needed to like apply it or grasp it. and you do have so much information around it. But I feel like you do hold it loosely, I guess you could say. You are very like, apply this how you need to apply it. And you saying that literally 1,000,000 times gave me the comfort of like, I do not have to do this. Like, this does not have to be my entire 1 hour session, is not just the LTAP and the application of it. I can do this the way I want. I can use it for 30 seconds at the beginning of my session and do everything else the way I want. This can inform me, I don't have to fit into the LTAP box. So that was like, so once I got like understood that, that gave me a lot of freedom to like just take the information and use it how I feel like it's going to benefit my people. So that was really good. I learned so much from the online, and every time you would run a new phase of it, like you are very generous with your alumni. So I would always take the additional classes like as they would come through, just because new questions come up and it just reinforces. And I think I took the online like 2 years before I did the in person. The in person was fantastic, and I'm so grateful that that gave me so much more confidence. And then being able to talk to Julie, who is a massage therapist, was really valuable. So both were really great, but I feel like for me the easiest starting point was just the online. Yeah, I think I don't know how else to say it. I feel like it's just a really cool way to see how the body works, like viewing it from that lens. And when you can see someone's body change based on the information you got from the LTAP is like, I don't know it's like,
So cool.
it says it's not traditional, if this, then that. So being able to look at it through that lens is like, it's cool as a practitioner to like, yeah.
I love it.
Okay.
Thank you. I understand that. Yeah, it's good. Well, thank you for joining me. I really appreciate it. Thank you to everybody who's watching live or catching the recording. And yeah, I'll be putting this up on the podcast too, so you can share it with anybody you want. And yeah, I'm just so appreciative of you in the community. I thank you for sharing, and
Thanks, Anna.
hopefully I'll see you soon.
Yeah, sounds good. Thank you.
You're welcome. Bye-bye.